Hello YouTube, I'm Dr. Fox. Today I'm gonna talk about the fact that no method of contraception is 100% effective. Effectiveness depends on which method you use as effectiveness rates, that is, how effective they are at preventing pregnancy, vary. However, all methods have higher effectiveness rates if they are used correctly, which means according to instructions and every time you have sex. If you sometimes don't use contraception or you don't check you are using it properly, it will be less effective. Some contraceptives can have side effects and all have disadvantages and advantages, which you should consider as well as their effectiveness rates. Your doctor can give you more information. Okay, so what are perfect use and typical use rates? We are going to use the terms perfect use and typical use to describe how effective the different contraceptive methods are. Perfect use means you use the contraceptive 100% correctly and every time you have sex, while typical use means what most couples do, not always remembering and not always using it 100% correctly, which is known as user failure. An example might be that you forget to take your pill one morning, or you don't put a condom on before the penis has contact with the vagina. A 99% effectiveness rate means that fewer than 1 in 100 women will get pregnant in a year. A 90% effectiveness rate means that up to 10 women will get pregnant in a year. Most contraceptives have different perfect use and typical use effectiveness rates. For example, under perfect use, a contraceptive might give 99% effectiveness, but under typical use, the effectiveness rate might drop to 90%. Okay, first, how effective is the contraceptive pill? There are two types of contraceptive pill, the combined pill and the progestogen-only pill, also called the mini pill. Both have 99% effectiveness rates for perfect use and 91% effectiveness rates for typical use. Next, how effective are long-acting reversible contraceptive or LARC method? LARC methods are either the birth control implant, which is put in your upper arm, or the intrauterine device or IUD, or intrauterine system or IUS, which are put into your uterus. Once these have been put in by a doctor, you can forget about until they need to be renewed. So there is no such thing as user failure for these. All three LARC methods have a 99% effectiveness rate as long as you have the device or implant taken out and renewed when it is out of date. The implant works for 3 years, the IUS normally works for 5 years, and the IUD can stay in place for between 5 and 10 years, depending on which type you have. Okay, next, how effective is the contraceptive injection? Under perfect use, this is over 99% effective, but under typical use, it's around 94% effective. User failure usually happens because you have to remember to get the infection renewed every 8 to 12 weeks, depending on which type you are using. Next, how effective are the patch and ring? Under perfect use, both are more than 99% effective, and under typical use, both are around 91% effective. Next is male and female condoms. Under perfect use, male condoms are 98% effective, but they are only around 82% effective under typical use. Female condoms, on the other hand, are about 95% effective under perfect use and 79% effective under typical use. Okay, next, how effective are diaphragms and caps? Under perfect use, diaphragms and caps are between 92% and 96% effective, which drops under typical use to around 71 to 88% effective. Next one, natural family planning. Under perfect use, natural family planning can be up to 99% effective. In this case, perfect use means monitoring more than one fertility indicator such as cervical mucus and body temperature and being taught by specialist teachers. Under typical use, the effectiveness rate drops to around 76%. Lastly, how effective is sterilization? For a woman, sterilization is more than 99% effective. Around 1 in 200 sterilized women will become pregnant over their entire lifetime. For a man, the rate is around 1 in 2000, again over the course of their entire lifetime. Thank you for watching. See you soon.